Good afternoon and Happy New Year. My name is Jeff Stauffer, Community Relations Director with Elville and Associates, and welcome to our webinar today, the fourth in the Elville Webinar Series new wellness series titled Setting Goals for Your Health in the New Year, presented by Ms. Ellen Platt of the Option Group and Dr. Michelle Fritsch of Retirement Wellness Strategies. So how this will work today, if you're new to our webinars, if you are, welcome, we're glad you're here. And if you're a frequent attendee, we're thankful as always for your support of the Elville Webinar Series. So you as the attendee are in listen-only mode. However, if you have questions or comments and we really want to encourage attendee participation during this webinar, please note them in the questions panel or chat box on the right-hand portion of your screen. Ellen and Michelle will also pause periodically throughout the presentation to get your feedback regarding what they're discussing. You also received the presentation by email from me yesterday for your convenience to take notes on it if you wish. If for some reason you did not receive the presentation yesterday, it is currently located in the handouts section in the panel on the right-hand portion of your screen to download at this time. Everyone will also receive a post-webinar feedback email right after the presentation, and we ask that you please just take a couple minutes to fill out the simple survey, offer us your thoughts and feedback about the presentation. So Elville and Associates works every day with families, with clients, with ideals of client education, collaboration, and compassion in mind. And you should expect nothing less from us anytime that you partner with us, and we're always available for consultations to discuss your family's planning needs, and we always look forward to being a resource to you in any way, now and in the future. So at this time, I'd like to welcome back and turn the webinar over to our presenters. Again, Ms. Ellen Platt and Dr. Michelle Fritsch, who will share a bit about themselves and get started with the presentation. So Michelle, and I'll turn it over to you.
Thank you, Jeff. Ellen, I skipped ahead, so go ahead and introduce yourself.
I'm Ellen Platt. I'm founder of the Option Group. I do private case management and advocacy. And I have a master's in rehabilitation counseling. So I come from the rehabilitation perspective that there's always a way to make things better. So we're looking at ways to improve our wellness, to improve our quality of life, and to create the best scenario that we can in many aspects of our lives. So we're going to be talking about some of that today. And our topic today is going to be talking about our New Year's goals. If you remember when we were together in November, we were talking about setting goals for wellness and strategies that we might carry into the new year. So now I'd like to introduce Dr. Michelle Fritsch.
Hi, all. I'm so glad that you are here. So I'm a clinical pharmacist. I've been a professor all my life, but it was the number of people I saw retiring, seeming fine, and then their health plummeted. And as I got to know them, I realized that was completely preventable. So I started a company called Retirement Wellness Strategies, which is a one-on-one strategic planning process for health and long-term health and retirement. And then if you've listened to us before, you know that Ellen and I have joined forces and started, and it's officially launched as of last week, a new product called Propel Comprehensive Wellness, where you get the best of what each of us offer in a monthly subscription format. So we'll tell you a little bit more about that in the future, but today's about you and your goals. So we first encourage you to grab pen and paper or an electronic device, because we're going to ask you to do some things today, and we want you to have a chance to write things down, as well as we'd love for this to be interactive. So we're going to be asking questions and would love for you to answer those. Again, the chat is available to you as we go. So last time we talked about ways to prepare for the holidays. So our first question for you is, what resonated with you if you were at that session? What resonated with you of the strategies that we talked about? And then what did you actually use? If you did some things to focus on your self-care over the holidays, will you put that in the chat? Tell us what you did. And then Ellen and Jeff, since I'm driving the slides, I can't see the chat. And so if there are things there, will one of you read those out?
Yeah.
And if you didn't do a great job of self-care, what did you do that cared for other people over the holidays?
Now, one of the things that I did is I completely unplugged over New Year's weekend. I went almost 4 days without touching an email, without checking in, and it was really nice to disconnect. So there wasn't that weight of what if something came in, what if I needed to respond to it. So that was, for me, a way that I took care of myself over the holidays. But please put in the chat if you guys had some good strategies that you used, or some thoughts that came up, or things that worked really well for you over the holidays. Put that in the chat and share it with everyone else.
You can also note that in the questions panel. That'll also work just as well.
Michelle, what did you do over the holidays? Anything?
I had my kids together for a short time, but I think my lesson was that you can make quality 2 hours with all of your kids just as special as back in the days when they were younger and everybody was together all of the time. So I think I reframed my perspective to be just as happy when I get them for short bits.
So we have somebody that said, I allowed myself to enjoy the holidays fully without restrictions because I devoted myself to a good year of workouts and routines, so I knew I could enjoy the holidays guilt-free.
Oh, I like that.
So that was a
That's
way that you could celebrate and reward yourself for the hard work throughout the year. Awesome.
And we have somebody else that says, Michelle, that is what I did also, echoing what you did.
Yeah.
There's
Yep.
somebody here that said, I got more sleep.
Good.
Let's see here, what else?
And I think with the pandemic, a lot of people were figuring out different ways to do traditions and have those gatherings, maybe in smaller groups, or break them down, or do them by Zoom. We're all trying to be a little more creative and figure out ways that we can still connect in a meaningful way, but it just may be different than what we were doing before.
That's a great point. There are ways to still do. It's just maybe very different than the way that we're accustomed to doing things. Well, we also last time talked about goals for 2022. So if you set goals, I hope you have those there in front of you. And if you haven't quite done that, we're going to talk about that here for a little bit. So Ellen, do you want to kick us off?
Yeah, so we'll, while we're talking a little bit, if you could go ahead and put into the chat again some things that you had envisioned for 2022. If you were here for our previous webinar, just put that in there and share some ideas that you have. If you haven't, maybe start writing down a couple of ideas that you hear that maybe resonate. So we're going to really talk about SMART goals and what they are. We talked about that a little bit, and it's really, you know, a lot of people will say, this is something that you hear a lot of people say, I want to lose weight. That's great. But let's make them SMART goals, not just an idea, just not a concept, but actually something that we want to do, and with the steps that we're going to put into place of how we can do that. And so that is, the SMART means specific, measurable, attainable, relevant, and timely. So we want to be specific with our goal, not just I want to lose weight. How much weight do you want to lose? And is it realistic? Maybe you want to read more. Instead of just saying I want to read more, what is it? I want to read X number of books a week. I want to read X number of minutes a day. Break it down into smaller steps so it's more attainable, and you're biting off, you know, bite-sized chunks that you can actually accomplish. So making it really specific. And then measuring it. How are you going to measure it? Are you going to keep a log? Are you going to journal? Are you going to track the minutes that you spend exercising, reading, whatever it is that you want to do? And what exactly are you measuring? Is it time? Is it weight? What are the metrics that you want to capture while you're trying to reach your goals? And making it attainable, again, breaking it down into those smaller chunks so they're more attainable. Maybe saying in the first month, I want to do this. In the second month, I want to do this. How do we break it down into smaller steps that are easy to follow and easy to get back on track? Relevant. Is this relevant to you? Is this a goal that you really want? Because if you want it bad enough, we'll figure out a way to do it. And then what we also want to do is kind of track that. Maybe midway, your goal has changed. Maybe you've decided to go in a different direction. Maybe it's not that I want to lose weight. Maybe it's I want to get more toned, and the weight may come with that. But you want to make sure that it's a relevant goal. It's something that you're interested in, something that you're going to follow up on, so it's attainable and you can reward yourself. And then also timely. Let's give it really specific time frames, not just kind of generically, I want to lose weight by the end of the year. How can we break that down into smaller chunks and have like goal lines that we're gonna or yard lines that we're gonna reach before we hit that goal? So those are the kinds of things we want to think about when we're thinking about SMART goals, is making it a little bit easier to digest. Michelle, did you have anything to add to that?
Well, I mean, I'm one of the worst. You know, I'm going to read more books this year. That is too nebulous. I'll never know if I'm meeting the goal because I'm not clear what the goal is. So I broke that down into, and I got to be honest, I listened to more books than I read, but like a certain number of books per month, and kind of when I was going to squeeze that in so that I could track whether I was doing it or not, and then I could decide, is it still important to me? Do I want to keep going? If I didn't do it well last month, what do I need to change so I can make that a higher priority this month? So that the SMART aspect of making it something where I can tell whether I'm achieving what I want to or not made all the difference in actually getting it done.
Good idea.
So this sort of reiterates the same thing, but there are a lot of different tips when you're going to set a goal for how you can make it determined. Am I going to be able to make it? Do I have the specifics that I need to know if I'm achieving what I want to? And then in the middle of this one, Ellen, one of the things that caught my eye is the accountability piece. I have a woman that I meet with weekly for accountability on some things, and she dropped me a text about an hour ago, and she said, have you done this and this that you said you were going to do? And that was really helpful because I had gotten distracted with some other things, and it brought me back to focus.
Yep. Yep, and also prioritizing the goals. So which ones are most important? One of the things that I did this year is there's so many things that I like to kind of keep my eyes on, and you know, it might be reading, it might be exercising more, or cardio, or strengthening, connecting with certain people. And what I realized is it was so hard. I would do really good with one aspect, and then the other aspect fell off the screen. And so what I did this year is I got a piece of graph paper, simple graph paper, and along the top, I put each of those things that I wanted, that are important to me, to at least keep track of. So this is helping me track what I'm doing. It's making me mindful of what I'm doing, but it's also telling me if I haven't done it in a few days. And then so every day of the month is down the left side of the page. Each thing that I want to try to accomplish is across the top. And at the end of the day, I check whether I meditated, whether I got some reading in, and how many minutes, if I connected with somebody that's important to me, checking in on my aging parents. I mean, there's lots of things that I do throughout the day, and I will check it off, and I can see that if a few days went by and I haven't done something, it gives me a cue that I need to get back to that. But then I can see over a month I'm actually doing a whole lot of things that are reaching a number of different goals. I may not hit them every day, but at least I can see, kind of track my progression.
Another one I like is the positive. Don't we all respond better if our goal is stated in the positive? So instead of, I don't want to be such a fat slob next year, how can we turn that into positive? I want to have more energy. I want to be able to go out and do things more frequently. I want to be able to walk further. I want to be able to walk to a certain distance by March. The more positive, I think, the more likely we're going to follow through with goals. So the next part of this is there's so many aspects of our lives to consider when we are setting goals. So we're just going to talk through a few of these. One is your career. If you are still working, what do you want to achieve in your career? I'm often working with people that are nearing retirement, so that gets even a little bit more complicated. There's the things that they would normally want to accomplish in a year, but now they're trying to wrap things up, maybe complete some final bucket list items. They're trying to train their successor, the person that's coming behind them in their career. So trying to get a handle on what do I actually want to accomplish and what's most important this year. And then financial, both short and long-term financial goals, that's a great place for a SMART goal where you can check in and know if you are tracking and achieving what you want at various intervals.
And there may be certain times that you have a professional helping you with those goals. So for instance, a financial planner would have really great tactics on tracking and reaching those goals. So don't feel like you need to go it alone. If there's a certain area that's really important to you, pulling in a professional or an accountability partner or someone who can help guide you with getting the smartest goals in place, that's a great way to go.
Good point. And then education and training, no matter where you are in life, it's good to always be learning something new. I was just in an event a couple of days ago where someone said that they've dedicated themselves to learning a new, or exploring, not necessarily learning, exploring a new hobby every month until they can find the ones that they want to really sort of pour themselves into. But I know people who are still taking classes in their 80s and 90s, and so there's no point at which you stop learning. So think about, what do you want to learn, figure out, explore this year. And then relationships are key. Going back to the perspective of, I'm often working with people around the time of retirement, it's amazing how the key relationships within your day change with retirement, because those people that need you all day long when you're in the workplace often stay in the workplace, and when you leave, they're not such a key part of your life anymore, and the relationships that are important in your life from retirement on are different. So making sure people are thinking about that and identifying which relationships they want to really pour their energy into. Like Ellen said, making sure that the key people in your life know that they're the key people in your life. How could you set goals around that? Attitude, oh my goodness, have you noticed, maybe it's just my world, there are so many articles and pieces being written and apps being shared for how you can enhance your attitude or your mindset. Whether you're thinking about things in the affirmative, positive, can-do spirit, or if you're looking at them in a more negative way. Certainly, the more positive we can be about our approach to things, the more likely that we're going to want to do it and that we will achieve it. And then I find usually when people think about their goals for next year, they're thinking more about the physical, about their weight, about their exercise goals, number of times to the gym, how many pounds they can lift, how many reps they can do, what their diet is going to look like, what kinds of foods changes they might want to make. The big thing in the people around me lately is how many hours they're going to fast between meals. So whatever those goals are, think about your physical health and what you want to do in the next year to enhance that. And then just a few more, your recreation, your free time, what energizes you? What do you like? What relaxes you? And how can you spend more time doing those things? What are you doing for other people? It's amazing how when we do for others, it comes back and it blesses us, and it gives us so many positive feedback mechanisms. So what are you going to do for others? And then spiritual, whatever your spiritual belief pattern is, we've talked before that your spiritual health is a core component of your overall health. So these are just some additional areas for you to think about as you set your goals for 2022. It's a clean slate. So many possibilities await you. What sorts of goals might you want to set?
Great. So grab that piece of paper and pen that we talked about at the beginning. And we're going to use this time to do a little bit of journaling. So just sit in your chair, try to relax the stress out of your shoulders, take a couple of deep breaths, and breathe the stress out of your shoulders. And then just think a little bit about your goals and things that you've been thinking about for the new year, whether you did them formally or not, whether you attended our last program or not. We're now 11 days into the new year. So I want you to just, whatever is coming to mind, just write down, how are you doing? Have you taken any steps towards those goals? Maybe you've thrown the goals out the door already and you're thinking, I'm not sure if I'm going to do that. Or maybe you just haven't had a chance, been busy with the holidays and really haven't put pen to paper. So I'm going to take a couple of minutes here and just write down what comes to mind. How are you doing so far? And if you haven't really solidified anything or formalized it, this might be a good way to start. It's just putting down some things that are coming to mind, things that are important to you, things you might want to look into a little bit more. What kinds of things would you want to do in those different areas that we just talked about, whether it's financial, spiritual, health, wellness, mental health, whatever it is, write down some things that are important to you for this year and maybe something that you want to improve. So as you're writing it down, what is it that you want to improve about it? So just get that down on paper. We'll have a 30 seconds of quiet time for people just to write. All right, now we're going to do fast forward. Quick. I want you to put 10 things down as quick as you can that are important to you. Just write them down, get them on paper as quick as you can. Whatever comes to mind, even if you don't have the full concept, just write a word down or an idea down. Now you have a list of things that you can work on. And what you can do, it's kind of broad, it's whatever came to mind now after today. You can take that list and look at it, maybe prioritize, maybe dive into it a little bit deeper, and then start narrowing the focus on which ones are really, really important for this year. And you might have new ideas that you didn't have before. You might have elaborated on an idea you were kind of thinking about. But this is a list that you can take to start moving forward and solidifying your goals for the new year. If anybody had any revelations or any kind of neat ideas that just came to the surface, please put them in the chat and share them.
Yeah, we'd love to hear from you. Is this goal setting, is it helpful? Is it making you think about it differently? We can acknowledge that the last 2 years have been incredibly hard, and 2022 is off to a rocky start. So I've had some people tell me, I don't even want to think about the year ahead. I'm just going to hunker down and take it as it comes. We're here to propose that you can still set goals and have high hopes and dreams for the year ahead, knowing that there's uncertainty around it as well. So I encourage you to go ahead and think about your goals, think about your future, think about things you want to accomplish this year in spite of the unknowns that are coming. And Ellen, that probably leads right into our next slide, doesn't it?
Yep. Yep. So we're going to start thinking about how in control do you feel that you are in your health and wellness journey? And starts with totally out of control, goes up to totally in control. Probably we're somewhere in between. So just this is for you, for your information. How in control do you feel that you are in your health and wellness journey?
So we do have a comment.
Mm-hmm.
We do have a comment. So I recently retired, but my husband is still working for this year. I've been spending more money than I should, but I am having trouble putting this goal in the positive.
Mm-hmm. Mm-hmm. Yep. So there's a couple things going on. There's two people in the same household that have a different structure to their day. We have one person that recently retired, so their whole world has kind of changed. And then we have, we've noticed a little bit of change in maybe spending habits. Maybe we're trying to find ways to fill our day. So in the positive is maybe some financial goals of saving, so that might counteract the spending, but also some goals of how do I want to meaningfully spend my time.
I think that's a key element is that finding that meaning or that fulfillment when life has changed that dramatically. And we're going to talk about that actually in a few minutes.
Yeah.
Anyone want to comment on where they feel they are in this continuum from out of control to totally in control? Does that also bring up any thoughts of sort of how that fits in with your planning for this year?
There's somebody that says mostly in control with their exercise habits.
Good.
Great. And are there any things for the person that wrote that? Are there any things in particular that's kind of led to the success? Are there any tricks you've learned along the way that keep encouraging you?
Seems like the right time to throw this in. I've never been a gym person. I just don't really like going to the gym. Neither am I an athlete, and that's obvious, but I have found certain kinds of dancing to be the way that I want to stay healthy and exercise. And then once I found that, there are lots and lots of apps, lots of videos and instructional kind of things that help me with the weird kind of dancing that I like to do. I just like to move. And so if you don't like to go to the gym, but you want to have good exercise routines, I will tell you there's a lot out there. And so find what you do like to do that's fun, because you're more likely to do it when you find it fun.
So she has responded saying, I am trying to go to the gym every day and have met a group of women that hold me to that.
Great. Awesome. And that's the accountability partner that we talked about. Just making your wishes known. This is what you want to do. This is my goal. And then you have people who want to support you in that journey. And that's one of the ways that they can do it. So good for you. Yeah. And then not only do you have an accountability partner, you have a newfound group of friends. It may spill into other areas of your life. It's awesome.
Love it.
Congratulations. So one of the things I want you to do is pull out that piece of paper again, and we want you to, there's going to be 3 columns. Column 1, I want you to list 5 things in your life that you feel you have control over. Column 2, 5 things in your life that you have partial control over. And then column number 3, 5 things that you don't feel that you have any control over. I'll give you a couple of minutes to put that down. Okay, so now that hopefully you have 5 things or close to 5 things in each category, what we want to do is, as we're starting to look at goals and how we're going to be heading into the new year, 5 things that you have control over, they probably make you feel good. You've probably had successes already, and those are things that you can build upon to increase or improve or enhance or tweak whatever you're doing in those areas. And since you have control over them, take advantage of that control. 5 things that you have partial control over, you might be able to make some inroads into being able to get more control. So looking at them, and what piece of that do you not have control over? What piece do you have control over? And maybe something you could start to take a little more control, and then you're adding to your list of things that you do have more control over. Now, the 5 things that you don't have control over, we want to look at that. What is it that we don't have control over? Is it because of other people? Is it because maybe we have some limiting beliefs about our ability to have control over them? Maybe it's things that we just haven't really explored. So it gives us a place to start and see, but we really want to focus on stuff that we have control over and how we can improve that. Michelle, did you have anything to add?
No, I think this is an important exercise just to do once in a while. And I know for myself, there are things I feel like I don't have much control over, but like you said, it's self-limiting beliefs. It's because I've gotten into a rut to do it a certain way. But there are other ways to do it where I could regain some of that control.
And that's where sometimes reflecting and journaling and thinking creatively, maybe sharing with a friend, and maybe coming up with some other ideas that you hadn't considered before.
Do we have any new comments? Does this?
Yes, Michelle, we have somebody asking if you could please give us examples of things that you do not have any control over.
The one that pops in my head is COVID and what's going to happen as far as will there be new variants? What will be the new rules? There are things that are going to happen that just happen. But then how we respond to those, how we protect ourselves from those are things where we do have some control. And so how do we focus more on those things?
Yeah. Another example would be that we don't have control over what other people do or think or say, but we do have control over how we respond to that. And so focusing on how you're responding in maybe a positive way, or not getting sucked into the drama, is just figuring out things that you can control that maybe makes this scenario a little bit more positive.
And choosing to spend time with the people that build you up and make you feel good, and limiting the time as you can with the people that have more of a negative impact on you, and trying to sort of alter the balance of that so that you have a lot more of the positive interactions.
Yeah. Another example would be that we don't really have control on what's going on in the world. We are all seeing the news, and we see the negativity and the crime and the polarization and the political stuff, and COVID and what's going on with the new Omicron variant. And so we don't have control over those things. So we can't spend our time trying to control that. We can do what we can do that we can control, like wearing masks, getting vaccinated, washing our hands, turning off the news, or just limiting the dose of news so that we're not just ruminating on what's happening, and find other ways to spend our time. You want to be educated, you want to know what's going on, but instead of 3 hours of news in the evening, get the highlights, and then focus on time with family, or learning something new, or putting that dance video on, Michelle, and spending time getting some exercise and feeling, getting those endorphins pumped and feeling better about ourselves. So just finding things in a chaotic situation that you do have control over, and capitalizing on those things.
Well stated. We had started to talk about this a little bit earlier when someone shared that they'd retired and their husband hadn't. I left a lot of years in academia to pursue this need that I saw of people retiring and then having a decline in their health, and realizing that that was so often preventable, but sometimes we don't find out it's preventable until it's happened. So how do we get in front of that? And one of the things that I found in all of this is that our health is such a complex thing that has so many layers. So there's our physical health. Do I have diabetes? Do I have high blood pressure? There's our mental health, which is attacked emotionally by the news, by the relationships, by so many things. There's our social health. And I mentioned before that when we retire, our social network can change so dramatically. So how do we prepare for that? Our spiritual health, whatever that looks like for us. And it all comes down to 3 basic human needs. No matter who you are, no matter how wealthy or poor you might be, no matter how famous or unknown you might be, we all have these 3 things in common. One is we all need that sense of meaning and purpose. One is that we all need to know that we're important and that we belong here on the planet and here among our groups. And then we all need to love and be loved. We need those connections. So focusing for a minute on the purpose part, I even wonder if we might want to give this more dedicated time, maybe in a future episode or webinar, because it is so important. Your purpose is your source of that engagement and fulfillment, and what challenges you, what makes you get up every morning and be excited about your day. And what I have found as a clinician is it's so closely tied to your health. Now, your purpose in the very young parts of your life is to learn and to grow, especially to learn. And then there are parts of your life where your purpose might be more centered around creating a solid foundation for your life, for your family, maybe raising children, being in a marriage. And then your purpose might change as your career grows and your purpose might be more related to achieving particular goals within that. But at every phase of life, we've got something inside of us that pulls together our unique interests and our skill sets that we've developed, the insights that we've gained over time in a new way that keeps us excited and engaged in life. And so that, as I've been studying and researching and following people as a clinician for years, I'm finding this is such a key element. And once you know or better understand your purpose and where you're really headed in the next phase, goals can then come and align with that. So I'd love to pause here and ask, is this resonating with anybody? Does this make sense? Is it something you would like to pursue further, or do you kind of have this, feel like you have this figured out? Anybody willing to interact with me?
I have a couple people saying they absolutely would want to pursue this in a future webinar.
Okay, we will do it. That would be great. If you invite us back, Jeff, we'll do it.
And then we have somebody that says, has a question related to that. So when you retire, how do you find your new purpose in life?
That's exactly what we could focus on in another webinar. Is there a number of steps to help do that?
Yeah.
Excellent.
Yeah, and that may be something you want to explore in your goals, is finding that purpose. Michelle had mentioned earlier about the lifelong learning. Lifelong learning is a great way to learn something new, to experience something new that perhaps you didn't have time to pursue earlier because you were busy working or raising children or doing things like that. But it gives you a taste of other things that might be exciting for you. And the added bonus is that trying something novel or trying something new helps us slow down the rate of decline of cognition. So as people are aging, when we see people that are in the early stages of dementia or early stages of cognitive impairment, what we want to do is engage their brain. It's just like exercising. You're using different muscles of the brain for different tasks. So learning a new instrument would be one thing. Learning a new language would be another thing. Doing crossword puzzles would be another thing. Learning about, cooking or something else. And so all these activities that we've been talking about use different parts of the brain and different logic and different areas of the brain, and that's how we're able to slow the rate of cognitive decline. So finding purpose in retirement or purpose in life in general is really important for us to be able to stay engaged and social and active and all those things that we want to do to slow the rate of cognitive decline, but also depression and isolation, which further magnifies that decline. So we want to find things early on that really, what floats your boat? Let's find something new, or maybe renewing our interest in something that we had done, a hobby or something we had done years ago, but just didn't have the time to pursue it, and it kind of gets pushed in a box in the corner of the closet. So let's pull that stuff out. Let's explore a little bit and see if there's something that interests us, either old or new.
I have an exercise we can follow next time, but I have a teaser story just to kind of set the stage. So this gentleman was the CEO of a big health system that I used to work in. And when he retired, when he was younger, before college, before all that he became professionally, he had played a little bit of guitar. When he retired, he started fixing guitars. He got interested in taking older guitars, especially high-end guitars, and figuring out how to make them really sound good again. He wasn't necessarily great at playing them yet, but he started fixing them. And then he started learning kind of music theory and playing them. And then he found this whole new social network of people that like to get together with their instruments. And he's just his world has pivoted so much from that healthcare administration to this world of music and guitars and all of these other people that are interested in the same thing. So I see him as a great example of somebody who, it doesn't have to be at all related to what you did professionally, but just finding that new love, that new thing that you want to engage in.
Yeah. There's also some folks who maybe had a specialty skill or something that they were doing while they were working. They're no longer doing that. That's a great opportunity to be a mentor to somebody young, up and coming, that would love to have an older person to kind of show them the ropes and encourage them in their career path. So volunteerism is another way to doing that. Delivering for Meals on Wheels, doing wellness checks for somebody who may be a shut-in. There's all kinds of things out there, nonprofits that would welcome volunteers. There's actually a website. I'm going to see if I can find that before we're done, where you can, volunteermatch.com is a place that you can go in, put in your skills, and find some local resources in your area that may be looking for those skills.
I love that. Reminds me of another story, a former professional athlete who had coached kids throughout his professional time. Once he was no longer a professional athlete, he became a coach. Now he's at a phase in his life where he's not coaching, and he was not comfortable with electronics until COVID. Then he got comfortable with Zoom, and it's like this light bulb went off, and he realized he could now coach a kid that wants to learn his unique athletic ability anywhere on the globe. So that opens opportunities to teach kids skill sets that could even lead to scholarships or open new doors for them. So learning Zoom plus his coaching abilities opened up all sorts of new possibilities.
Great.
We will be sending you some more information about Propel, which includes bringing a lot of these sorts of concepts together into a monthly subscription format. Ellen, did you want to add anything about Propel?
Yeah, just it kind of to summarize what we've been talking about is like looking at these different areas of our life, whether it's health and wellness, spirituality, health, fitness, personal interests, things like that, volunteerism, purpose. And Propel has a bunch of different modules that help address some of these deeper dives into the questions that we have about how do we move forward, how do we set goals. There may be some resources or tips or tricks that we can share that would help propel your wellness.
And we know that nobody wants to sit in front of a camera for long periods of time. So everything in Propel, what you get each month is about 8 or 10 pieces that are 5 minutes or less each. So you can kind of take a little bit and think about it, take a little bit and think about it, as well as a workbook where you've got that place where you're asked some key questions. You can gather your health data together.
Right. And it is self-paced, so people can go at the pace that works for them.
I'll say also, Michelle and Ellen, that I had the opportunity to try out Propel. And one thing I did like about it was self-paced, and the modules, they are very thorough, and the videos as well that are provided, they are narrated by Ellen and Michelle. They're very helpful, and they're put together in a unique way that I found very engaging. It gave me kind of a sense that by following the program, I could be in control of my retirement. I've got a long way to go before retirement, but I could see in the future, once I finish working and move on to the next stage of my life, I could kind of set goals and have a positive purpose in hopefully the next 25 years or more of my life. So I encourage everybody to certainly check it out.
Thank you, Jeff.
Thank you.
Now we know that there's so much going around COVID right now, and we both in different ways are answering these sorts of questions for people every day. So we wanted to give you, because it's it's everywhere in the news and things are changing so rapidly. Are there any questions on these elements of COVID or other things that we could help you by weighing in with some information about these things that would just kind of bring you some extra peace about this? And if it's a question we can't answer, we'd be glad to find that answer and get it to you. While people are posting their questions, I do want to speak directly to the monoclonal antibodies and the new oral antiviral therapies, because I've seen information in the news, but I feel like it's so confusing. So prior to the Omicron, there was a monoclonal antibody that you could either go and have it infused via IV, or pharmacies were starting to take it out to people, and it was like a subcutaneous injection, like those teeny tiny needles where you kind of pinch an inch in your stomach and you could stick it in there. That was a great option, and there was a lot of it available. And now Omicron does not respond to that monoclonal antibody, so they had to shut that down quickly. Keep in mind, we didn't even know about Omicron until right at the beginning of December. So we're only, what, 6 weeks into knowing anything about Omicron. One of the things we learned was the monoclonal antibodies we were using to help people fight the infection and help reduce their symptoms, that it doesn't work with Omicron. There's one left, one type of monoclonal antibody that works with Omicron, but it was not available in big supplies. And so most states have chosen to keep that for the sickest people to allow them to have a better chance to fight off the virus. So as most people get Omicron, thankfully, most vaccinated people are having milder symptoms. But for those that need the hospital, the monoclonal antibodies aren't as readily available as it was before. There is one that works, but most of them are only available through the hospital now. Now, there are 2 new promising antiviral therapies that are both by mouth. They're like tablets or capsules. They just got approved, like just got approved, and so they're being distributed to pharmacies now. But the data looks pretty good that they could do the same. It's a different mechanism, but it helps the person fight the virus if they have the virus, so that they don't get as sick. So as those get rolled out and pharmacies have bigger supplies of them, then that will be an option. So we're probably talking another week or 2 until there's plenty of that available. The one thing to know about those is they interact with a number of medicines. So make sure that you talk with your doctor or talk with your pharmacist about every medicine you use to make sure which antiviral therapy would be appropriate for you or a loved one or someone you know that gets the Omicron virus and is having some significant side effects or significant symptoms. I don't know that I made that any easier to understand.
So we do have a few questions.
Okay.
First of all, what is a monoclonal antibody? If you can answer that first, please.
It's an antibody. Like when we get an infection, our body builds up antibodies to fight that infection, and then the vaccine is given to us to help our bodies build antibodies to fight the infection. Well, the monoclonal antibodies are antibodies that have been grown outside of ourselves that are given to us for the same purpose, to help fight the infection.
Okay.
To help. So it's like outside antibodies to help you fight.
And then next question is, how quickly do you need to take the oral antiviral in order for it to help you?
That is a great question. And because they were just approved, I haven't yet found a really clear answer to that, but let me keep looking. And by the time you send follow-up information, Jeff, let me just double check if I can find an answer to that.
Okay. And then the next question is, what preventative medicines or supplements do you recommend?
Preventative medicines or supplements. It's a great question. And Ellen, feel free to weigh in as well. Anything you can do to keep your immune system intact. So eating good foods, getting plenty of sleep and rest, taking care of yourself overall. Vitamins, I've not seen anything that very directly says this is going to make a difference as far as a supplement or a vitamin, but it won't hurt to take a multivitamin. Your body will just typically wash away what it doesn't need. So especially if you feel that your diet is not as complete as it could be, then a multivitamin might make sense.
Okay. Let's see if we have anything else. Okay, we've got another one here. Oh my goodness, let me see if I can pronounce this word. What is COVID pre-exposure prophylaxis?
Prophylaxis. So a new medicine, Evusheld, was just approved about 3 or 4 weeks ago, and it's designed for people that can't take the vaccine, can't get the vaccine, or maybe they had 1 dose and they had a reaction such that their doctor doesn't want them to have another dose. Then Evusheld is a medication that they can take to help their body fight the virus and decrease the likelihood that they'll get it or that they will have such a big reaction, get so sick from it. It is another medicine because it was just approved within the last month that is not readily available on the pharmacy shelves just yet, but it's coming. And it's very specifically for people with either immune systems that don't maybe they get the vaccine, but they don't keep that good response to be able to fight the virus. So Evusheld can help that, or it's somebody that cannot get the vaccine, and this is an alternative. So that big word, pre-exposure prophylaxis, it's something that people can take before they get the virus, so that if they do get exposed to the virus, they have some tools available to fight that virus, similar to what the people with vaccines have. Now, I want to be careful. I've had some people say, great, I'm not going to get the vaccine, I'm going to take Evusheld. I don't think there's enough data yet to say that it's equal, that it's just as good, and Evusheld has been approved specifically for people that have immune system weaknesses that really need an alternative therapy available to them.
Okay, thank you very much. Another question. I think we hit on a nerve here. There are people who are ineligible for the vaccines/boosters. What are safe activities for immunocompromised, unvaccinated people to participate in outside of the home?
It's a great question, and it's a difficult question. Right now, with the way Omicron has absolutely exploded, I don't know that there is anything truly safe with other people. What I would recommend, and if the weather allows, is rather do hiking and walks and outside activities and still be distanced. You know, if it's somebody from your own household, you're already exposing one another, you're already together. But I really right now wouldn't recommend any sort of gathering with other people in that scenario.
And the last one we have here for now is please spell Evusheld.
E, V is in violin, U, S, H, E, L, D is in dog.
Okay. And those are all the questions for now. Thank you.
Good ones. Let us know if it would be helpful to have like an open forum like this to talk about the latest changes, because it feels like I do a weekly update on new science around all things COVID. And I started that because clients wanted it and friends and family wanted it back in March of 2020. And this Friday will be number 99. I never dreamed this would still be going. but there is new science and there's new discoveries and new information to talk about every week so far.
So kind of as
So we're having a couple people saying that they would be interested in that open forum. So
I can send that link as well. Okay.
Good. So for closing activity, I wanted you to get that piece of paper out again, flip it over from your goals. And what I want you to do is write dear and then your name. And then write, I'm proud of you because, and I want you to list 3 things. So please go ahead and do that. Give you a little bit of time to put those down on paper. Dear, your name, I am proud of you because. And hopefully you've gotten 3 things down. Feel free to add more later. But what I'd like you to do is once you get down a few things that you're really proud of yourself about, put it on a little note card, tape it to your bathroom mirror, put it someplace you're going to see first thing in the morning, tape it to your computer, whatever it is, and make sure that you actually read it and feel the words. This is what we call affirmations. And this is a way that we realize, kind of recognize ourselves for the good things that we're doing and the strides that we're making and the goals that we are reaching. So sometimes we need a reminder. We tend to gravitate towards the negative and the part that's missing and the half empty glass. This is our half full glass right here. And so in the mornings, that's a great way to start. I'm proud of you because. Leave a little bit of extra room on that list because you're going to be coming up with some other things that you're proud of or other things that you accomplish that you can add to the list. But try to mindfully do that for 30 days and see if the mindset is a little bit different next time we get together.
We went a bit over, Jeff, but thank you as always for inviting us to be here.
well, thank you very much. We do a lot of webinars each month, and this is always my favorite one. Not just because I get to see both of you, but I think that it's so very important, and I think that this was just terrific. So thank you both for your knowledge and the self-help that you provided, and I've learned a lot about myself today as well. So this is not only helpful to all the attendees, but helpful to me too. So in a great way. So thank you very much. And I look forward to trying to put something on the calendar for February as well, if we can do that. So I think we do it the 3rd Tuesday of the month. Is that right?
Typically.
So yeah, so I think we can look forward to that, and we hope to see everybody back for our next one, the 3rd Tuesday of February, which I don't know exactly what date that is, but we'll make sure that you're aware through an invitation coming out soon. So we have a lot of thank yous for a terrific session from our attendees, so thank you again. We're running short on time, so just briefly, we've got some good webinars coming up through our Elville Webinar Series, so check out our events calendar on our website. We've got a couple coming up next week, Estate Planning, Elder Law Essentials, and Achieving Perfection for Your Legacy, Tuesday and Wednesday of next week with Mr. Elville. So, and I'll be sure to send out the video for today's presentation and some information about Propel Wellness if you're interested in learning more about that, and some other information that Michelle's going to forward to me. I'll send that out in a message before midday tomorrow. So thank you again, Ellen. Thank you again, Michelle, to everybody for being here as well. And we'll look forward to seeing you again soon. Have a great day.
Thank you.
Bye.